up, folks, this ain't no drill. Grab your coffee, fuel the thrill. It's the podcast road to GP fame. Be an awesome GP is the name. Diagnose with style, prescribe with flair. You're a GP boss with skills so rare. Laughter's the dose, humor's the key. Tune in now to be an awesome GP.
Hello, awesome GPs, and welcome back to the show as I look at videos of my past self without grey hair. Today, we are very lucky to be joined by Dr. Anita Muñoz, candidate for the RACGP presidency. She brings a quarter century of clinical and leadership experience to the table, a practicing GP, a practice owner, and a medical educator who understands the realities facing general practice every day. On the leadership front, she has chaired RACGP Victoria for the past 6 years and sits on the National College Board. Her resume highlights a strong focus on direct political advocacy and has leveraged her position on state health advisory committees to help secure significant funding for GP respiratory clinics and priority primary care clinics in Victoria. Her pitch centres on being a practicing GP in the trenches who also knows how to negotiate directly with government. Welcome to the show.
Hi, thank you for having me.
So before we get into policy, tell us your story in brief. How did you come to general practice and what brought you to standing for president?
I knew from the beginning of medical school that I wanted to be a generalist. I couldn't decide on any particular specialty, and in actual fact, I thought that only dealing in one specialty would be incredibly boring. I was not very happy in hospital medicine. I knew that I wanted to be out in the community. The hospital system didn't suit me very well, and I didn't want to have to just choose one specialty. And I love general medicine. I like having a really broad range of skills and knowledge. I was influenced and lucky to be taught by John Murtagh himself, and I can still remember those days at Moorabbin being taught by him. And so it all ended up that I was always going to be a GP. That was what's going to suit my personality and my style best. And I like seeing patients throughout their journey. I don't want to lose them to follow up like many of us. And so I love our profession. I think we have the best job in medicine. I still stand by that. And every time I go to work, I feel happy to be there. I want to see my patients. I love working in a team environment. I love the flat hierarchy of general practice where no person is better than anybody else and everybody is important to the team. And that reflects my value system and my philosophy. So it certainly is an environment that I feel comfortable in. I've definitely found my tribe, but of course I feel really impassioned about that, and I have observed over 2 decades or more that there is a fairly negative narrative going on out in the Australian politics and in the media and in some elements of society where general practice is being devalued. And so I feel very strongly about defending my profession and changing the tide of what I see incremental defunding of our profession and a devaluing of our profession. And I want to do everything that I can to stop that.
And I think there is a feeling amongst GPs sometimes that it feels like fighting the tide. It feels like King Canute sort of standing on the shore trying to tell the tide to not come in. But I listen to leaders like yourself, and I see some of the wins that we have chalked up, and it's easy to lose them sort of over the last few years. You see some of the wins, and it does reinvigorate you. So I guess I'd really love to hear what things, since you've served on the RACGP board, what's one decision or position from the last couple of years you're genuinely proud of and really excited about for the profession? And are there any you'd have approached differently or you've got a different lens on now?
Look, one of the things I think is worthwhile pointing out is that we do have an enormous grant with the federal government. Now, that's a huge win in its own right. It's the biggest grant between the federal government and a college or for any training that exists in Australia. And it's been renewed. We went from a 3-year grant to now we've got 5 years of a grant, and that had to be re-signed and renegotiated. So I think the college having training back is a huge win for the college and for our profession. And we know that satisfaction has gone up with return of training to the profession, etc. More GP trainees are entering training. But there was a fair bit of controversy when we did negotiate the second iteration of the grant, where it appeared that we were being asked to guarantee that registrars would be put into exclusively bulk billing practices, preferentially over all the other types of practices that exist in Australia. And I'm very proud of our board, because we said that that was not going to be something that we would be accepting of. And so we're very happy to continue training registrars. We're very happy to get registrars out into the community, into rural areas in particular. But we have promised registrars that they will have a high quality experience and that they will retain some autonomy over their own choices. And so if a registrar has the choice between two practices and they want to go to one, and that is a mixed billing practice, then we will not force them to choose a bulk billing practice. And so we did not put that agreement into the grant, and I'm very proud of that, because we did stand up for high quality training and the registrar experience. And so that's something that I think that we did very well, and it required careful negotiation, but it required us to be very resolute about what our values were in terms of delivering training. There are other things that where being a board member, would say, yes, we can and we should do things differently. So since we issued the most recent fee notifications, there's been a lot of backlash from our members saying that the fees have gone up too far this time, and it's not reflecting the sensitivities around cost of living and the fact that many of our GP members work part-time. And so I think that the way we look at our fees has to be looked at carefully. We have to take that feedback on board. Looking back, I would have done that differently now, which of course we can't do. But going forward, we need to be really sensitive about the different fee structures we have. Do we need more member categories that reflect how much people earn in the profession? And we certainly need to be very careful with the indexation that it only reflects CPI and not higher.
I guess I'm a dad of a 2.5-year-old, and I have a very different lens on how I see the world now than 3 years ago, when I would have worked 5 days a week and I now work 3. Tell me about something else. Tell me about pharmacy prescribing, which is another one of those issues that it really fires people up. Scope of practice expansion keeps advancing state by state despite college opposition. What do you think is the strategy that actually changes that? We love embedding pharmacists in a multidisciplinary setting in an appropriate scope, but what do you think changes the rollout of pharmacy prescribing outside of that scope that we haven't managed to stop so far?
Yeah, look, I think that we've got to recognise that there's a lot of complexity in the way that decisions are being made by the government pertaining to pharmacy. So the first thing is that there is a very strong relationship between the Pharmacy Guild and the government. And the Pharmacy Guild is an organisation that's been lobbying since 1923, and they're willing to spend $2.5 million every 5 years on lobbying. So we have to recognise that that is a huge advantage for them. They can lobby because they're not a charity, they're an organisation. And essentially, they only represent pharmacy owners, of which there's only 6,000 in Australia. $4 billion gets poured into pharmacy every year by the taxpayer, and that is divided up amongst 6,000 owners. And so we have to recognise that that has a big impact on the way that organisation interacts with government. And then there is RACGP and our allies saying, look, we are more interested in quality and safety, and we don't want harm to come to patients because of inexperienced and untrained people suddenly prescribing medicines, and they don't have the clinical reasoning skills and the training to do that. There's going to be multiple layers to this argument, and this argument is going to go on for some time. So I think the first thing to say is, if you don't win an argument in the first year or two that you're engaging with the stakeholder, you don't walk away and give up. You keep at it. In my experience, sometimes there have been conversations I've had for 6 years before I finally can deliver a win for members, and that's been the case in Victoria. But I think we've got now evidence in terms of commissioning a report that says there is no international evidence that this is safe and that this works and that this is a proven quality. And that was one of the assumptions that the Pharmacy Guild made about their program. We also need to point out that the majority of pharmacy prescribing occurs in triple M1 areas, and it's delivered to people of means. So the idea that they're fixing a hole in the health system and they're serving vulnerable populations has been totally blown out the water, and so on and so forth. And so we're also talking about demonstrating when harms occur and encouraging people to report that, because we do know that the Guild is going to continue to suggest that we're making things up when we report harm. And so we're going to need patients to be their own advocates, and we probably are going to need AHPRA to get involved to actually put these instances of harm on the record. But the other thing that I think we will be doing in the future is working with organisations like the Centre for Economic Development in Australia and start to look at this from an economic argument. So we've got all of these assumptions have gone into this position that it will improve access, it will improve health, people will be able to get their conditions managed more readily. But in actual fact, I think what we're going to find is it's going to cost more. There will be delayed diagnosis, there will be the cost of harm, there will be the cost of later presentations, and so on. And so you have to keep layering in an argument as complicated as this and never walk away from it and never give up. And I think that that's where you've got to be prepared to play the long game.
And I think not every second day, it seems like someone on GPs Down Under has posted about being banned from one of the Pharmacy Guild of Australia's posts by presenting a rational evidence-based argument. You have got a very strong track record of affecting change. I was looking at your helpful timeline on your website, which is really quite impressive, the number of wins you've chalked up. I don't know if you wanted to talk about some of those wins or if you want to talk about how we get more GP registrars into practice.
Look, I think that the best indicator of what my leadership will be like is the fact that I've proven results already, and I've been doing that for 6 years. And as you would probably know, the environment in Victoria has been one of austerity, and it's also been one that's been politically very challenging. And so to be able to convince the government in Victoria to listen to us and then to meet our needs and in actual fact spend money on general practice is something that I'm very proud of. And so we did save many practices in Victoria from looming and catastrophic retrospective payroll tax bills. And we were losing general practices as a result of payroll tax in Victoria. And the amnesty has prevented many of those practices from closing. And that took a lot of gumption to take that fight to the Treasurer and to the SRO and to the government. And similar to what I've been saying about pharmacy prescribing, I was never going to walk away from that argument. I was never going to give up. And I still haven't given up because I have an agreement from the Liberal Party and National Party that they will give an industry-wide exemption if they are elected. And I'm going to continue to apply pressure to Labor to provide the same. We've also convinced the government to put a GP on every rural hospital board in the country for the first time in over 25 years, because I'm aware that Victorian hospitals are having very poor relationships with the GP VMOs in many parts of the state, and it was not something that I was willing to allow to continue to happen under my watch. So the fact that we've had some of those very much structural changes. Also, when we talk about getting GP registrars into clinic, Victoria was the first state that produced the $40,000 GP registrar grant that recognised that GP registrars have a reduction in their income. And when we achieved that grant and we rolled it out, there was an enormous interest in training in Victoria. And as you know, that policy has now been deployed nationwide, and it is a permanent national policy to support general practice trainees. So we have had those wins and more in Victoria, and I am confident that I can do that at a national level because the political environment and the funding environment in Victoria has been harsh, and we've still been able to advocate for our members nonetheless, and I feel very confident that I can do that.
What would you say to someone considering going into general practice as a registrar? They're weighing it against another specialty, and I guess they're contemplating, is this an environment in which general practice is winning, or is this an environment in which it is very challenging for general practice? Is it both? There has been tremendous wins in the last few years for general practice registrars in terms of pay equalisation and in terms of achieving maternity paid leave. What else do you think the college can do to encourage registrars to take up general practice?
So I think that there are things internally that we can do in the college to make our systems more streamlined and to reduce some of the bureaucratic burden inside of training itself, and to support GP trainees even more, particularly our IMG trainees, but also our trainees that are wanting to go into rural areas, etc. So I think we do need to go inside of our own organisation and remove bureaucratic processes that don't add to quality and safety in a meaningful way. And then also defend some of the policies that we have, because they are there to protect registrars and provide them with high quality experience and safe experiences as well. But I do want to point out, and I like the balance of your approach here, is that while we do have many things that we have to continue to fight for, we have had significant wins as well. And I believe that the future is bright. I have bought into my clinic in the last 4 years because I stand by the fact that general practice can have a bright future, and it is the basis of the Australian healthcare system. But there will always be issues for which we will need to defend and promote our profession. Every generation has had to do so. Every generation has had its political and funding and policy issues that have needed to be resolved. So I don't panic in a situation like this, and I certainly don't get spooked. But what we need to do is arm ourselves with a sophisticated strategy. We absolutely need to have allies. If we are going to go to Canberra to prosecute an argument, you do not go alone. It is much better if we go with other peak bodies, with other colleges, if we take patients with us, so that the government can understand that it's not just our own point of view that we're prosecuting, but we are speaking for the Australian healthcare system at large, and we are speaking for the Australian patient. And so that will gather us the momentum we need to make sure that we are not ignored as a profession.
And I guess just touching on going to Canberra and the GPs at Parliament sort of initiative, I was lucky enough to go to the New South Wales GPs at Parliament one. And it is wild being a GP in that setting, because in many ways you're still treated like a GP in a consult room, and they just ask you health questions that it feels like everyday work, but it's in this wildly different setting. And I think it is one of the great initiatives that we have that helps sort of show what we do. And I've only been to one, so I can't really comment in full, but it's a marvelous initiative. You did also touch on practice viability, and that's a big one, obviously. Costs, payroll tax, the gap between rebates and actually delivering the cost of care. What's your top funding ask of government? We already touched a bit on it, but what would be the top funding ask of government, and what's your fallback if you don't get it in your term?
Fundamentally, we have to get the overall funding parcel to go back to what it was as a minimum. We had 8% of the federal health budget in 2003. We are down to a paltry 5.5% now. So we are going backwards. And so the government overall has to accept that it needs to invest urgently and significantly in primary care in Australia if our healthcare system has any chance at sustainability and efficiency. And the evidence for that internationally is irrefutable. So the overarching ask is, don't offer us the same in more complex ways with more red tape and more difficult means of accessing resources. We need to simplify the way that we fund, and the overall funding envelope has to go up. It has to be a meaningful boost into our sector. Now, there are ways to achieve that. And of course, one of the things that we need to do urgently is restore that which has been lost. It is unacceptable in my mind that a general practice who delivers 80% of the mental health care in our country would have lost mental health consulting numbers. They must be returned as a matter of urgency. And also, we know that GPs all over the country are paying out of their own revenue for going into a treatment room and delivering a procedure to patients, because it actually costs more to do a procedure than the rebates offer. And so no GP should be paying to do procedures out of their own pocket. So we want procedural item numbers back, and we want to be rewarded for doing more and not left to pick up that tab literally ourselves. It is unacceptable that the government is willing to spend $250 or $280 per service in an urgent care clinic and leave an everyday general practice with $60 per service and no stipend for the use of the disposables in the treatment room. So that inequity in funding needs to stop, and we should all come from a level playing field where all general practices have an equal capacity to not just survive, actually, but I want us to thrive. And the fallback position is there is no fallback. We just keep at it and we keep at it, and we ask in different ways, and we approach it in different budget cycles, and we use different allies, and we use different strategies, and we present our argument in terms of economics, but we don't fall back. That is my fallback.
We don't fall back. I love that. Is there anything else you would like to add to our listeners about your candidacy and what you would like them to understand about it?
Look, the reason that I put myself forward for this presidency is not because I want to go into politics and, I don't want to be an internet sensation. I don't want any of that. I find it a bit irksome. But I genuinely believe that in terms of the person who has the courage and the stomach and the strength of character to go to Canberra and to prosecute what needs to be done in the next 2 years, I am that person, because I do have the commitment and the purpose, and I'm very resolute about doing whatever is necessary to protect and to save my profession from what I believe to be the disaster of loss of clinical autonomy, loss of billing autonomy, and a system that looks a little bit too much like the NHS for my liking. So I will do anything in my power to stop that reality from occurring here in Australia. And then I'm going to go back to my clinic and I'm going to see my patients and run my business. And that is what I'm in it for.
Well, thank you very much. It has been fantastic chatting to you. You are an awesome GP, and we all appreciate the work you have been doing, and we look forward to seeing what you do in the future. I will also point out that we have run a full 30 minutes without waking my rowdy toddler, and I think that's also a win.
That's an awesome toddler.
Thank you, and you have an excellent day.
You too. Thank you, Chris.